So we work to include in the most recent coronavirus legislation $1.5 billion for what we called a competitive shark tank. This shark tank at the National Institutes of Health would utilize the capacities of government itself in coordination with the private sector to pull out all the stops and fast-track new technologies designed to produce tens of millions of tests by August, or at least millions more tests by August, and even millions more than that by the flu season. There is no safe path forward to combat the novel coronavirus without adequate testing. Let us hope that out of Dr. Collins' Shark Tank will emerge at least one mighty great white shark that will help us combat this disease.
We have to remember that the fight against this virus is reality. It is not reality television. It has to be led by scientists, and it has to prioritize public health, not profits, not politics. And while innovation plays an important role in the development of vaccines and treatment and tests, there is no silver bullet. The problem is not lack of innovation, it is lack of national leadership and a plan from this White House. You can innovate the fastest car in the world, it still won't get you to where you're going without a good driver and good directions. And when it comes to testing, this administration has had no map and no one at the wheel. There is a reason they say failing to plan is planning to fail. And it absolutely applies here, because the fastest, most innovative test is not much use if we don't know how many tests we need, if we don't have a supply chain with capacity to manufacture all the tests and supplies that we need, and if we don't have the workforce and lab capacity to actually use those tests and supplies.